Hello everyone, I'm Molly Lund. I'm here today with Alana Chilton, and we are board certified genetic counselors. And we'd like to talk with you today about what that entails and who may benefit from genetic testing. Alana, would you like to start us with a definition of what genetic counseling is?
I'd love to. Thank you, Molly. So genetic counseling is the process of providing information about how inherited diseases and conditions might affect you or your family. Genetic counselors like myself and Molly are healthcare providers with specialized training in medical genetics and counseling. We can actually further subspecialize in many different areas, including oncology. Your doctor might refer you to a cancer genetic counselor if you have a personal or family history of cancer. It's our job to assess what your risks for inherited cancers might be, review your genetic testing options, and then work together to decide whether or not genetic testing is right for you.
The next question people may ask themselves is whether a genetic test is right for them. When thinking about your personal and family history, people may have features that meet guidelines for genetic testing. Some of the things you might think about yourself when considering your own family history would be whether there are early diagnoses of cancer. So that would be younger than we would typically see. Or perhaps you might find that there are multiple people on the same side of the family with the same kind of cancer, or maybe related cancers. And finally, sometimes even a single diagnosis of a rare cancer would be enough to think about genetic testing. There are a lot of kinds of genetic tests, but here at the Sarah Cannon Cancer Institute, we focus on hereditary cancer genetic testing. And when you're thinking through your family history, it's really important to think about both sides, both your mother's and your father's. Alana, would you like to talk about how the testing works?
Absolutely. So it's actually a lot easier than you think to get genetic testing done. It does require a sample collection, and that sample might be blood, but more often than not, we're able to use saliva and cheek swab samples as well. If we see you in person, we'll collect a sample from you that day. But if we see you via telemedicine, which we're doing a lot more of, we're able to send a collection kit directly to your house, and you can collect that saliva or cheek swab sample right from the comfort of your own home. It usually takes about 2 to 3 weeks to get genetic test results back, and we always call you directly with those results.
Once we get those results, we'll talk through any recommendations for your care. So if we happen to find a hereditary cancer trait that's running in your family, there are specific steps to follow related to cancer screening tests and ways that you might reduce your risk of developing cancer. It's also really important to know that even if your testing's normal, we may still make recommendations about cancer screenings based on your family history. We will communicate all of that to you and to your doctors.
So the next thing we think about is, how do you make an appointment with us? And if you need an appointment with genetic counseling, you can ask for a referral from your PCP, oncologist, or other healthcare provider. We're able to offer you both in-person and telemedicine appointments.
We hope this information was really helpful and you learned a lot more about genetic counseling and genetic testing. If you have additional questions, you can reach us at 816-276-9005, or you can visit researchmedicalcenter.com. Thank you.